Welcome. I'm Betsy Abramson, the director of the Wisconsin Institute for Healthy Aging. I'm delighted to be talking with you today. This webinar is for potential leaders, registered program providers in Wisconsin, and other partners interested in high-level evidence-based health promotion programs. The Wisconsin Institute for Healthy Aging was formed to advance both the spread of evidence-based prevention programs throughout Wisconsin and the nation, and to encourage and support healthy living through partnerships with public and private organizations. We have a research arm that's hard at work designing, developing, and testing new interventions. And WIHA is also a clearinghouse and support center for many community-based workshops and programs that promote healthy aging and healthy living. As you'll learn from this webinar, WIHA provides many services and tools to support you and your partners in increasing access to these programs in your local communities. Have you ever seen this? It was developed by the University of Wisconsin School of Medicine and Public Health. It shows the 4 factors that are considered the determinants of health: individual health behaviors, clinical care, social and economic factors, and physical environment. Look at it here in this pie chart form. What generally surprises folks most is that clinical care impacts only 20% of your health. The biggest impact on our health comes from those top 2 slices of the pie. Our own individual health behaviors at 30%, and note that that is bigger than clinical care, as are the social and economic factors, which is 40%. Our evidence-based health promotion programs fit squarely in that 30% slice, individuals' own health behaviors. The Wisconsin Institute for Healthy Aging programs help people learn how to better manage their own health through the knowledge they gain and then their own goal setting related to exercise, diet, weight management, medication adherence, socialization, their own home environment, how they interact with their healthcare provider team, and how all that will affect health. What do we mean by evidence-based health promotion programs or prevention programs? These are programs that reduce chronic diseases and falls. It's important to know that many issues adults face are highly preventable, like falls, chronic disease, complication from chronic disease. These programs can really turn the tide. They improve quality of life and health behavior, health and functional status, and overall well-being, as well as confidence in managing your health. And they reduce healthcare costs. These programs also help form community partnerships. Community organizations and healthcare entities can partner to implement evidence-based health promotion programs because making strong community clinical linkages is integral to promoting good health and reducing disease and disability. Let's look at the slide's 4 major points in defining an evidence-based health promotion program. First, it's a proven program that promotes health and prevents disease. Second, it's based on research, science. It's been proven. And at WIHA, we only accept and administer programs that meet the gold standard of research, in that they are tested with a control group and an intervention group, and our scientific evaluators have reviewed the data and concluded that the program works by comparing the results from the 2 groups. Finally, these are packaged programs. They have carefully designed training programs for the leaders, and they are based on a very carefully designed and tested curriculum. Our program leaders learn how to deliver the program and commit to delivering the program with fidelity, just as they are taught, because the only way to guarantee the same good outcomes is to deliver the programs in the exact same way that the program was designed and evaluated. This video is to prepare individuals for the upcoming training to become a leader of this program. We'll start with an overview of the program itself, why it's needed, the proven outcomes, and the workshop's basics. Then we'll talk about the reach this program has had in Wisconsin and the team you're joining. And finally, we'll go over what it means to be a workshop leader, what you can expect from us, and what we hope we can expect from you before, during, and after the training to become a workshop leader. I'll now turn it over to a program expert who will provide the rest of the orientation information. But before I do, I want to take this opportunity on behalf of both WIHA and your local community to thank you for your interest in providing these workshops in your area. Let's go.
Hello, I'm Laura Armstrong. I'm a master trainer, leader, and coordinator of the Chronic Pain Self-Management Program. Let's talk about why healthy living with chronic pain is a needed program. First, let's define chronic pain. It's a discomfort that persists for 3 months or more and can be caused by many different factors, most notably chronic conditions. Pain affects more Americans than diabetes, heart disease, and cancer combined, about 100 million Americans and is one of the most common reasons adults seek medical care. 4 in 10 Americans say pain interferes with their mood, activities, sleep, ability to do work, or enjoyment of life. Two-thirds reported an interference with any one of these. Pain is a major component of many long-term health issues and is emerging as a health concern on its own, impacting a person, their families, and society as a whole. Many struggle to find ways to manage their chronic pain, since the most common treatment for chronic pain is pain-relieving medication. Older adults have been increasingly prescribed medications to manage this condition. This can lead to misuse and abuse, often unintendedly. While medications should be a part of a treatment plan, a person's plan should also include a self-management program like Healthy Living with Chronic Pain. A few consequences of chronic pain to mention are: in the US, the total annual incremental cost of healthcare due to pain ranges from $560 billion to $635 billion in 2010, which combines the medical costs of pain care and the economic costs related to disability days and lost wages and productivity. Chronic pain is the most common cause of long-term disability. The prevalence of pain has a tremendous impact on business. The annual value of lost productivity in 2010 dollars ranged between $297.4 billion to $335.5 billion. The value of lost productivity is based on 3 estimates: days of work missed, hours of work lost, and lower wages, as well as having an emotional and physical toll on individuals and families. In a 2006 study, over 300 chronic pain sufferers, 2 out of 3 reported pain impacted their overall enjoyment of life. More than 3 out of 4 patients reported feeling depressed, and 86% reported an inability to sleep well. All of these factors compound on poor health. Healthy Living with Chronic Pain is here to help. The Healthy Living with Chronic Pain program is a small group, community-based workshop that meets for 2.5-hour-long sessions once a week for 6 consecutive weeks. It's led by 2 trained leaders, one or both of whom are non-health professionals with chronic pain themselves. It has a preset curriculum for leaders and is very interactive for the attendees. This workshop is for individuals with chronic pain or someone who lives with someone who has chronic pain, like a spouse, sister, or caregiver. Chronic pain may include many types of conditions from a variety of causes. The goal of this program is to give tools to help individuals manage their pain. It exists in nearly all U.S. states and is in a few different languages. So this is a high-level evidence-based program that meets the U.S. Administration on Aging's highest standard for evidence-based programs. It was developed by Stanford University's Patient Education Resource Center and is now disseminated through the Self-Management Resource Center, also called SMRC, worldwide. Over the years, it's had a variety of pilot testing, curriculum refinement, and research. You can find more research outcomes on the SMRC website's bibliography page or through WIHA for local data or further resources. Researched and proven to help people with long-term pain issues. Study found that on average, people who have participated in the Healthy Living with Chronic Pain program have more vitality or energy, improved mental health, less pain, less dependence on others, and are more involved in everyday activities, and are more satisfied with their lives compared to those who have not taken the program. The program has also been delivered and evaluated across pain clinics in Ontario, Canada. Evaluation of the program found it to be beneficial for participants in terms of coping skills, pain cognition, and overall quality of life. The program has some underlying concepts. One is people with chronic pain have similar experiences, concerns, and problems. Through these highly interactive workshops, participants will share, listen, and help each other over the sessions. Next, people must manage their pain and the impact it has on their lives and emotions. Leaders help participants learn tools to increase their self-confidence in being able to manage their symptoms while learning how their pain affects their lives. Lay leaders lead as effectively, if not more effectively, than healthcare professionals. What studies have found is when health professionals lead a workshop, participants will learn more. But if peers lead the workshop, participants end up doing more. And the latter help maintain long-term behavioral change. The last underlying concept is that the program process is as important, if not more important, than the subject matter. People learn best by being taught a little bit, having a chance to try what they learned out, and then getting feedback and building on what they learned. It's through this process participants get activated in their health and feel less alone in the process. Who are these programs for? Adults with chronic pain, such as low back or neck pain, or pain that radiates from your shoulders into your arms. Others may have fibromyalgia, headache, pelvic pain, or complex regional pain syndrome. People who live with someone who has chronic pain are also welcome to attend. Something to note, while Healthy Living with Chronic Pain is not a program designed to prevent addiction to pain medications, such as opioids, it does provide participants with alternate methods for managing and decreasing pain and improving mental health to help avoid misuse of pain medication. What do we do and talk about in the workshop? Well, each session has about 3 to 5 learning activities on various different topics. These are listed on the slide, as you can see listed. Some key elements that are part of every session are practicing problem solving and decision-making techniques, creating and completing an individual weekly action plan, also known as short-term goal setting. Also important, midway through the workshop, the group learns a gentle flexibility program designed to safely loosen muscles and joints and increase circulation for almost all people with chronic pain, the Moving Easy program. Lastly, the group contributions from the people attending really drive the program's outcomes. Now that you understand the program itself, let's talk about the training to become a workshop facilitator or leader of the Healthy Living with Chronic Pain workshop. You'll attend the training in pairs or solo if you already have a trained leader to co-facilitate with. The training is 4 full days, starting at 9 and ending around 5 each day. If you're already certified in another SMERC program like Living Well or Diabetes, you may opt to take the 2-day crossover training. In the training, you will learn the issue and impact of chronic pain, as well as the impact this program has on those who attend. You'll learn the Healthy Living with Chronic Pain program curriculum. Essentially, you'll see the trainers model each activity of the 6-week workshop in the 4 days of training. You'll learn new skills like group facilitation techniques, including practice teaching in front of your peers and working through possible real-life scenarios. You'll also learn the various ways you are supported throughout this process, locally and statewide. We're all here to help. So missing even a piece of this training could greatly affect your full understanding of this program and its offering. So again, you must attend the entire training to become certified in this program. We're looking for friendly individuals who enjoy helping people and can speak comfortably in front of a small group. Your time commitment is that you attend 4 days of training. Be sure to confirm with your employer if applicable. Once a certified leader, you'll need to block about 4 hours a week when leading the 6-week series. This includes the setup time, conducting the workshop, and packing things up. Some additional time during the week may be needed to prepare for the upcoming session and to call participants. This is a highly scripted program, meaning the information to be presented in the workshop is already set for you. You have to be comfortable leaving your medical hat or personal theories at the door and follow the script as intended by the developers. This is to ensure that the participants' voices are the most heard. In the training, we'll teach you facilitation techniques and model skills to prepare you to lead a workshop with another certified leader, At least one of the leaders must have experience with chronic pain, personally or professionally. Together, you will help others learn how to take small steps toward permanent positive changes and healthier living. People who are past participants of the workshop are strongly encouraged to become leaders as they've seen the impact of these programs. Expectations of leaders: attend all 4 days of leader training, work with a local program provider, lead the workshop in pairs, both leaders are certified by a master trainer, lead 2 workshops each year, adhere to the curriculum, use required materials, follow WIHA protocols, including submitting workshop notification forms and data collection. This slide overviews the program material. During the training to become a workshop leader, you will receive your leader's manual that has all the instructions and a script to lead a workshop in your community. You'll also receive a copy of the Living a Healthy Life with Chronic Pain textbook that includes a Moving Easy CD, a relaxation CD, and a set of charts. These items are required for a leader to lead a workshop. For participants of the workshop, the Living a Healthy Life book with CD is required during the course of the 6-week workshop series. Your local area is in charge of supplying this item. It can be purchased through Bowl Publishing. Some areas will have the textbook for participants to purchase, while others offer a lending library approach. All of this will be addressed at the training to prepare you. Other materials needed are blank flip chart pads, painter's tape, markers, and name tags. Also, the ability to print participant handouts and offering refreshments is a great courtesy to participants. I'm going to turn it over to my colleague Jill Rankin to talk more about implementing this program in your area.
Hi everyone, my name is Jill Rankin and I work for WIHA as the Director of Program Provider Partnerships. I've been working with the self-management programs for 12 years now, and my role is to work with organizations at a leadership level in implementing the program in their communities. We here at WIHA do believe that organizational support is essential for program leaders to be successful in implementing the workshops, which is why my position is dedicated to organizational support. Another step in preparation for your training to become a workshop leader is working with your program provider organization and area partners to be sure that your workshops are a success. So to do so, WIHA has created a planning guide for you to fill out, making sure that you're covering all the steps and are planning ahead. But fear not, you are not alone. Michelle is going to be joining us later in the webinar to talk a little bit more about the great support team you have backing you up. But it's also good to know the tools. You can find the planning guide at the link provided on the Leader Training Schedule website page or at the beginning of the Leader Training application. In order to complete the planning guide, you'll want to start with 2 important steps. Number 1, to identify your program provider organization, which we're going to talk about in a minute. And then number 2, if there are other local program providers, be sure to make contact with them in an effort of collaboration. So in order to provide organizational support to our program leaders, we have a process that will engage local leadership through the program provider registration. So what are program providers? They are organizations that deliver one or more of the WIHA evidence-based healthy aging programs in their community. They employ program leaders or support volunteer program leaders. This does look different in every area. There might be multiple organizations working together to deliver the program, therefore multiple program providers in the area. So who is your program provider? If your employer is paying your time in facilitating the workshops, then they are your program provider organization. If you are a volunteer doing it unpaid, your program provider is the organization for which you are facilitating the workshops for. And then if you're on your own completely, we ask that you please contact us here at WIHA. We will either assist you in determining who your local organization is that could be your program provider, or if that still doesn't apply, WIHA can be your program provider organization. Then how to register. It's a simple 1-page form that's online. You'll contact myself, Jill Rankin, and it will include just simple things like your organization contact name and information, the WIHA programs that are administered in that organization, and the geographic area served. All registered program providers do receive dedicated organizational support from WIHA. So as previously overviewed, you and your registered program provider organization and possibly other partners in your area will be filling out the planning guide together. So as you work with your program provider organizations, you will plan the following in order to prepare for your success. First, you are going to select the dates and the times for your first workshop. We do find that people who come to the training with their first workshop already in mind and planned are able to take in and apply the information learned from the training and then implement it right away once they're back home. The sooner you lead, the fresher your skills are going to be and the less intimidating it will feel. Then you'll decide whether the workshop will be for free or for a fee and then how much. You'll select and reserve a venue with appropriate room arrangements, and our planning guide will go into further detail around what those requirements and recommendations are. You'll decide who's going to submit your workshop notification form to WIHA. That will be worked out with your supporting registered program provider organization. And then what agency will receive the workshop registration. It should be somebody who can speak about the program and help people with any questions that they have related to the program. So as you can see, there's a handful of considerations to discuss with your program provider organizations. When your workshop is scheduled, the next step is outreach and marketing. And WIHA's website does have lots of marketing templates already made for you to download and customize. Then you will want to figure out where and to who this outreach is going to be happening. Track what works best in your area. We are striving to register at least 18 people per workshop. We also do have data collection for this program, which you'll learn about in the training or directly after the training. You may also need to talk with your area about ways to fund and sustain the program. The materials are low cost, but a cost is a cost, so it's good to have this conversation early. So I'm going to sign off and give the next slide over to Michelle, and she'll talk a little bit more about leader support.
Hi, I'm Michelle Camo, the Director of Leader Development at WIHA. Over the last 10 years, I've been a leader, a trainer, and a coordinator of these programs, and I'm thrilled that you're considering being part of such an impactful program. Now, I know you just received a lot of information, and let me reassure you, it's all in an effort to see the bigger picture of these amazing programs. Further, we want you and your community to feel ready for the training and ready to begin workshops. The last few slides will overview the support that's there for you as a leader, because the training is only part of the support that we give. So after the training, there is a post-leader training meeting, and that's held over the phone, and they happen about 6 to 8 weeks after your training. And this is a check-in rather than a check-up. We'll review a few WIHA-related items, but mostly it's there to hear from you and your fellow trainees about how things have been going since the last day of your training. We also have a leader section on our website where you can find all the great resources, current handouts, and whatever else is needed to plan, organize, and prepare you for your workshop, start to finish. We also have a leader listserv. So after the training, your preferred email address will be added to this leader listserv or discussion board, and it's a group made up of all the active leaders around the state in this program. It's a way to share, discuss, and get events or other important program updates from WIHA. We have technical assistance because technical assistance is really important for the success of this program. No leader should be flying solo. So building a local network of partnered program providers will not only be great support to you, but it also ensures the program success and in turn improves the health of your community. The more people that hear about it and learn about this low-cost, effective community wellness workshop, the better. If you don't know who your local program provider point person is, please contact myself or Jill Rankin. So WIHA staff are also available to help you with any questions. If you're confused about the curriculum or need advice about a certain situation, we're here to help. There's no wrong door. And if we don't have the answer, we'll definitely find somebody who does. But this office is a wealth of knowledge and has some really wonderful resources at our fingertips. All of our leaders and coordinators around the state. So periodically, we'll be offering webinars about this program, and the topics may be about best practices or highlighting a local area about their bright idea or showcasing a new concept to try. Announcements about these offerings will be made on that Leader listserv. So we want you to know how much we value your commitment and that we're here to help. I hope you're feeling prepared and excited. All right, so are you ready to become a leader of these workshops? Your first step is to complete the leader application found on our website to save your place at the leader training because space is limited. You're going to need to commit to the requirements outlined in that application, and you'll be sent a copy of these requirements with your application confirmation. There is a cost to the training, and you can pay that by credit card during the application process or select the invoice option, and invoices are sent after the training concludes. As Jill discussed, you're going to need to fill out that planning guide with your registered program provider in preparation for conducting your first workshop. And lastly, keep eyes out on your email. We'll send a confirmation that we've received your application. Then, once reviewed by staff, you'll receive an approval email confirming your place in the training and outlining all the logistics and the details around the training, like the time, the location, any pre-homework or expectations. And then lastly, you'll receive a reminder email closer to your scheduled training. Thank you for your attention today. If you have any questions or concerns, contact us. We gave a lot of information, and it's better to ask than be unpleasantly surprised later. A secondary big thank you is for being interested in this impactful work. These programs are valuable medicine for your community. Your success betters their health and their well-being, and we couldn't do it without you. So get those applications in, and we'll see you at training.